Hey guys, so let's talk about the medical team today. When you're working in acute care in the hospital, there's a lot of other medical professionals around you, and it'll be really important to know what everyone does and how you guys can work together as a team. So we're going to be talking about some of the main ones today. Of course, there are more professionals than the ones I'm listing right now. It's just the ones you'll be working with most often. So let's start. This is the patient. He's going to be Mr. Aardvark or Anteater or something. I don't know. He's actually my son's bath toys. So yeah. So patient comes in the hospital. He has some complaints, some symptoms, not feeling well. He'll see the doctor, and the doctor will ask him what's going on. Maybe take some blood tests or scans or something, and he will give a diagnosis. This is what I think it is. And treatment plan might be surgery, it might be medications, whatever it is. He'll say, this is what we're going to do, and he tells the nurse. So the nurse is the one that's responsible for the general well-being of the patient, for following out the doctor's orders for treatment, and this person is the one who's always there with the patient, so knows the most about it, and is kind of the first person that everyone reaches out to for questions. So a really important person to make sure to communicate with. Okay. Now, for some of these patients, the doctor is going to say, I think they would benefit from therapy. Maybe the person needs to mobilize after surgery, or the person is much more deconditioned than before and they're not sure what discharge location is appropriate. But not everyone, but a lot of patients are going to get PT, OT orders. So here's PT and OT. Yeah. And then just want to say the animals don't correlate to the personality, but I really like elephants. So the OT is going to be the elephant. Okay, so OT PT is going to see the patient. The first time they see the patient, it's going to be an evaluation where they're looking at, I think in the time that the person's going to be in the hospital, they are going to be able to go home afterwards, or maybe they're going to need rehab. OT and PT are determining discharge location and also equipment needs if the person's going home. They will send off their recommendations to case management. So case management is off to the side here. I find a lot of case managers work from home. They work remotely, and a lot of them are nurses. So they're very familiar with medical terms. Case management all this time has been looking at what the MD notes are saying, what the nursing notes are saying, and then now what OT and PT are saying. She's aware of medical terms, and also she's comparing them to the patient's insurance. So she knows what this patient's insurance will cover in terms of follow-up and equipment. And she is preparing the discharge so that when the doctor says, okay, patient looks stable, he's not needing hospital level care, he can leave, then everything is ready for the patient to go. Equipment is ready, the discharge follow-up is ready. So what does everyone want from you, and how can you contribute to the team? Let's talk about nursing first. So nursing is responsible for the general well-being of the patient. So check with nursing before you go to see the patient. The nurse might have opinions about whether the patient is stable to see, what is a good time to see the patient, what the patient might need before therapy, such as pain medications or blood pressure medications or whatever it is. When you go in to see the patient, what she would like to know when you come out is, how are you transferring the patient? Because she's the one that's going to bring them in and out of the bathroom, transfer them to the chair. How are you needing a stair steady? Are you needing a walker? Is the person bedbound? Does it need two-person assist? Also, in addition to that, any medical relevant information, like did the person become hypotensive when they sat up, or tachycardic, or is there anything, any place that the patient is bleeding during the session, or are there any lines that are leaking, as well as intake and output. So some people will have orders for water restriction. Important if before you give the patient a drink, to check in if they can drink water. Also aspiration precautions. And also, if the patient peed or pooed. So sometimes nursing will be tracking that. All important for them to know. Also, since everyone is contacting them for everything, tell them your discharge recommendations and equipment needs. So if case management calls, they know as well. Okay. All right. And then case management, obviously, they're going to need the note from PTOT about discharge location and equipment, so they can start preparing everything. In addition to that, they might be contacting you for patients that are needing updated notes, say for acute rehab or skilled nursing or whatnot. Some of these locations are going to need continued updated notes in order to accept a patient into a location. So that is what that person will need from you. In addition, if you have a really difficult discharge, for example, some people will have insurance that doesn't really cover anything, or they don't have insurance at all. Maybe they can't go to a skilled nursing facility even though they really need it. Then case management might ask, hey, how long will it take for this person to be safe to go to maybe a shelter or medical respite? You can say, hey, I think maybe in a week we can get this person to independence, and this is all the equipment they need. Then those cases are really important to work closely with case management. All right, medical doctor. So the medical doctor would be interested to know about any kind of medical issues that they could maybe resolve. So they ordered therapy, so they also have the belief that the person would benefit from therapy. So if there's things that are blocking therapy, for example, hypotension, maybe the doctor can order something that will allow the patient to have a more stable blood pressure so that the patient can progress further with therapy. Or even things that are as mundane as, say, for example, I had a patient in the ICU who every time we got to the edge of bed had a very big bowel movement, and we just spent the rest of the session cleaning her up, basically, and we couldn't get any further than the bed because every time she got up she'd have a bowel movement. So we told the doctor ordered a rectal tube, and while that's not pleasant, but it solved that issue so that we could get her further than edge of bed. The doctor can help you in terms of medications, stabilizing the patient, anything that's hindering therapy, they may be able to assist you with. So you can page them and let them know. As well as if you see findings that are concerning, they would be interested in knowing. For example, I had a doctor that thought there was a patient the patient had a stroke. And when I went to see the patient, I noticed that they had more signs of spinal issues, such as numbness in a certain dermatome, and I didn't find things congruent with a stroke. So I told the doctor, and they did a CT scan of the spine, and they found it was metastases to the spine. So you can help the doctor too. If you have findings that are worrying, you can contact them, and we're all helping each other, okay? All right, and then your partners in crime, PT. You guys will be helping each other a lot. If you see a patient before PT, or PT sees a patient before you, it's really helpful to inform each other of how the person transfers, and also anything to look out for, like maybe the patient needs to increase oxygen when they mobilize, or maybe things to look out for, like maybe the person's heart rate becomes really fast after doing this certain amount of activity, or the patient was asking, how do I put my pants on? Inform each other, and you'll be working together a lot. Sometimes you'll co-treat for patients, although most hospitals prefer you to have separate treatments and work with a rehab aide. But yeah, you will probably work most closely with PT. Note about some other healthcare professionals you might work with pretty often, especially if you work in trauma or a county hospital. You might have patients that need a lot of social work, follow-up. It's usually people with that need help with socioeconomic things like, say, food stamps or finding housing, or any kind of helpful programs for them. Social work will be very important to contact for that. There's also very common is a respiratory therapy. They'll be looking at how much oxygen the patient is needing when they move, and also carrying out treatments for oxygen like nebulizers and things. RT is really important to talk to about how much you can titrate the oxygen, and also tell them how the patient did on the oxygen while they were moving. So if they desaturated or if they were just fine. They would appreciate knowing that. So that is your medical team. You guys all work together to get the patient out safely and as quick as possible, so that other patients that are waiting in the ER have a room to go to, and so that the patient doesn't stay too long in the hospital. The longer people stay shows that they're more at risk for, developing other conditions, like, for example, like C. diff infections. So you guys are all working together. You all cover each other, look out for each other, and that is your medical team. So let me know what you guys think, and hope this was helpful to you. And yeah, I'm gonna do more videos. Look forward to it. Okay, bye.